Hi everybody, this video will discuss the gold standard exercises for greater trochanter pain syndrome. My name is Francesca Petplayer and I'm from the Physio Matters team. There will be two segments to this video. The first one is discussing the relevant evidence around GTPS, and the second is a practical demonstration of the exercises we've discussed today. So, greater trochanter pain syndrome, or GTPS as we like to abbreviate it to, is a broad term for pain in the lateral hip. So it can encompass a number of conditions, including trochanteric bursitis, gluteus medius or gluteus minimus tendinopathies. So in 2001, Bird et al. Examined MRI images of patients with known GTPS. And they found, which was completely groundbreaking at the time, that nearly all the patients had evidence of gluteus medius tendinopathy. What was really interesting about these findings was that bursitis was present in just 8% of the cases and did not occur without evidence of tendinopathy. So although the reasons for GTPS and these tendinopathies are multifaceted and contentious at times, and may include an element of compressive force due to excessive hip adduction, what we do know and what has emerged is that hip abduction activation and strength is a good preventer and management strategy for greater trochanter pain syndrome. We know that glute med is one of our primary hip abductors, and therefore we look towards optimal exercises to load this muscle and of course its tendon in order to improve the tendinopathy that we see in greater trochanter pain syndrome and our number of patients with this condition. In 2011, there was another paper by Fran et al., and they investigated exercises that produced the highest maximal voluntary muscle contraction in gluteus medius. So they did this using EMG studies, okay? And they found that the exercises that produced the most contraction in gluteus medius, they sort of narrowed them down to 5. And they were the side plank with abduction, both with the dominant leg on the bottom, and side plank abduction with the dominant leg on the top. The other exercises that they found that were in this top 5 were the single leg squat, a clam progression number 4, which we'll demonstrate later, and a front plank with hip extension. It's been well established throughout literature that higher maximal voluntary muscle contraction percentages correlate to muscle hypertrophy. So with this knowledge, it can help us establish which exercises may be best placed to strengthen gluteus medius and assist us with these tendinopathies and reduce the symptoms of greater trochanter pain syndrome. There is a caveat to this data. So it was EMG studies and it doesn't consider patient irritability or individuality. And of course, it is important to remember that this data should only be used as part of your clinical reasoning, not taken verbatim for every patient you come across. Patients need to be treated as individuals. So now we look at the practical demonstration of these exercises. We're going to cover the 5 top exercises that are highlighted in this 2001 Bird et al. Paper. Some of them are fairly challenging. So firstly, we have a side plank abduction with the dominant leg on the bottom. So you can use the upper extremity to support, and the leg is instructed to raise for 2 beats and lower for 2 beats. And of course it's very exact because it's a scientific paper. And the second exercise is actually incredibly similar, except for the side plank hip abduction has the dominant leg on the top. Again, you can use the upper extremity for support, except for this time, the participant is instructed to raise the leg for 1 beat and only lower for 1 beat. So the third exercise is the squatting. So they describe it as a single leg squat. It is really, in fact, a single leg sit back onto a 47 centimetre chair, 2 beats up and 2 beats down. Perhaps the most unusual exercise is the clam progression 4. So it doesn't resemble what we would accept a normal clam to be. It's side lying, hip extension, rotating the foot towards the ceiling, and then raising for 1 beat and lowering for 1 beat. And our 5th and final exercise is the front plank with hip extension. So we're in a plank, we extend the hip and we flex the knee, we lift up for 1 beat and we lower for 1 beat. So as you can see from our demonstration, these exercises are quite challenging, they're quite high level, and they are probably not suitable for every patient. They're certainly not suitable for everyone who walks through the door, and it depends who's in front of you. So these exercises can be progressed and regressed, so hopefully this video will give you a good starting point for treating greater trochanter pain syndrome.